Do you really understand what your blood pressure numbers are saying? A normal morning, you measure your blood pressure and see a number higher than every day. You might think, it's probably because of the cup of coffee. Probably I'm a bit stressed today. Or, I am still healthy. It's probably fine. That way of thinking is very common, especially when the body does not yet have clear signs. The problem lies here. Feeling healthy does not always mean that your blood pressure is stable. Sometimes, the most notable thing lies in the numbers repeating for many consecutive days. If they are frequently high, your heart and blood vessels might be having to work harder than you think. In this video, I will help you understand blood pressure in a simpler and more practical way. You will know why you should not ignore a high reading, why measuring blood pressure at home can give you more information than one single measurement at the clinic, and when you should bring those numbers to discuss with the doctor. Watch until the end, because when you monitor your blood pressure correctly and correctly understand the meaning of the indicators, you will be more proactive in monitoring your cardiovascular health. During a routine checkup in the US, a person over 60 years old walked in looking very calm. That person still walked every morning, still drove themselves to buy groceries, still cooked for the family on weekends. When asked if they had headaches, dizziness, or palpitations, the answer was, no, I feel I am still fine. But when measuring blood pressure, the reading was higher than the normally recommended level. The thing that surprised that person was not the number, but the fact that the body sent almost zero clear signs beforehand. This story shows a very important point. Blood pressure is not a feeling, but an indicator that needs to be measured and monitored. Understood simply, blood pressure is the force of the bloodstream acting on the vessel walls when the heart pumps blood throughout the body. When this force is frequently higher than the appropriate level, the heart must work more to push the blood along, while the blood vessels also endure prolonged pressure. Over time, that can affect the heart, brain, kidneys, and blood vessel health. Point 1. High blood pressure usually has no clear signs. And the first thing many doctors want older adults to understand is, high blood pressure does not always create clear signs. Many people over 60 still feel healthy, so they think their blood pressure is nothing to worry about. They still eat and drink normally, do housework, and drive to buy groceries. Because there are no headaches, no dizziness, and no palpitations, they assume the blood pressure reading probably has no problem. But this is the point that easily causes many people to skip checking. High blood pressure usually has no clear signs. You might not feel anything special, but the reading might still be higher than the appropriate level for many days. Medically speaking, blood pressure is the pressure of blood against the artery walls when the heart pumps blood throughout the body. The top number is called systolic blood pressure, reflecting the pressure when the heart contracts. The bottom number is called diastolic blood pressure, reflecting the pressure when the heart rests between two beats. When blood pressure is frequently high, the heart has to work more, and the vascular system has to endure pressure for longer. This does not mean that you will immediately see symptoms. Many people only discover high blood pressure when measuring at home, going for a routine checkup, or getting checked for another reason. Therefore, the feeling in the body is not a reliable thing to know whether blood pressure is stable or not. Measure correctly, record the results, and see whether the reading repeats over many days or not. For older adults, monitoring is even more important because blood vessels can change with age and underlying conditions. Therefore, do not wait until the body has clear signs to check your blood pressure. If you are already over 60, have had high readings, are taking blood pressure, medication, or have underlying conditions like diabetes, kidney disease, or heart disease, monitor more regularly. Measure at a fixed time, sit and rest before measuring, place your arm in the correct position, and record the results. If multiple measurements show a reading higher than normal, bring that record to your next checkup to discuss with the doctor. Once you have started measuring your blood pressure more regularly, the next step is not to rush to a conclusion from just one single measurement. Point 2. One single high blood pressure reading still cannot tell the whole problem. A high blood pressure reading in one single measurement does not always truly reflect your health because blood pressure can change throughout the day depending on many factors such as stress, lack of sleep, talking while measuring, or placing the arm in the wrong position can all make the result change. Even wrapping the measurement cuff outside a layer of clothing, sitting cross-legged, or not resting for a few minutes before measuring can also affect the reading. Therefore, the important thing is not to panic when seeing a high number, but also not to ignore it. Each measurement is just one small piece of data. What the doctor needs to see is multiple results measured correctly, at relatively stable times, to know how your blood pressure is trending. You can understand it simply like this. One single measurement only shows the reading at that moment. Multiple measurements over many days help you know whether the reading is frequently high or not. It helps you see a more complete picture. But this is the point many people miss. The problem does not only lie in the highest number you have ever seen. What is more important is whether that number repeats many times or not. From today, if you measure a reading higher than usual, do not just look and then forget. Please record the date, time, blood pressure reading, heart rate, and the circumstances at the time of measurement, for example, when drinking coffee, when walking, sleeping poorly, or experiencing stress. After that, continue measuring for a few days in the same way. If multiple measurements are still high, bring this record to the next checkup so the doctor has more information to evaluate. So how to know if that number only appears one time or is repeating? The simplest way is to measure at home and record it correctly. Point 3. Measuring blood pressure at home helps detect daily changes. In reality, some people only measure blood pressure when going for a routine checkup. Each time coming to the clinic, the reading is usually unstable, so they think their blood pressure only occasionally increases. But when starting to measure at home for 1 week, they realize the morning is usually higher than the evening. Some days the reading increases after a sleepless night. Some days it is higher again after drinking coffee. Thanks to recording every day, they clearly see blood pressure can change according to daily activities. Measuring blood pressure at home can help you see changes that are hard to detect when measuring at the clinic. Blood pressure can be different between the morning and the evening. It can also change after you sleep poorly, are stressed, or drink coffee, or eat saltier than usual. This does not mean that every change is a serious problem. But if you do not measure and do not record, you will hardly know which reading repeats over many days. Measuring at home also helps you better understand blood pressure during normal activities, not just when sitting in the clinic. However, the result only has value when you measure correctly. Before measuring, you should sit and rest for a few minutes. Do not talk while measuring. Both feet placed on the floor. The arm is supported at heart level. The measurement cuff is placed on bare skin and fits the arm. If possible, please measure at the same time every day. When measuring blood pressure at home, you should record the date, time, top number, bottom number, heart rate, and the circumstances at the time of measurement. Do not just tell the doctor that my blood pressure is sometimes high, sometimes low. Please bring the specific record to the next checkup. Numbers recorded correctly can help the doctor understand your condition more clearly and give more appropriate guidance. When already having a blood pressure record, many people begin to ask, why have I eaten less salty but the reading is still not as desired? Point 4. Salt is not the only factor. You have reduced salt when cooking, but your blood pressure is still not as desired? This is something very many people encounter. The problem might not only come from the amount of salt you add when cooking, but lies in the amount of sodium available in the foods you consume daily. Sodium is a component in salt, but it does not only come from your seasoning when cooking. In the American-style diet, sodium is usually abundant in processed foods, restaurant foods, canned foods, sauces, pizza, cold cuts, crackers, and some packaged foods. These items sometimes do not taste too salty, but can still contain a significant amount of sodium in each serving. When the body receives too much sodium frequently, in some people, the body can retain more water and make blood pressure harder to control. This especially needs attention if you have high blood pressure, kidney disease, heart disease, or are being advised by a doctor to limit sodium. Many people say, I already eat less salty. I don't add much salt. But when looking closely again, the meal can still include sandwiches, cold cuts, canned soup, accompanying sauces, or ready-bought foods. Each individual item might not make you pay attention. But if using many items in the same day, the total amount of sodium can increase without you realizing it. Therefore, instead of only asking, "Is this dish salty?" ask yourself, how much sodium is written on the label for one serving? When buying packaged foods, please look at the sodium or natri line, check the serving size, and compare between products. If eating out, you can choose dishes with less sauce, ask to leave the sauce separate, or reduce the accompanying processed items. But food is only one part. For many people, blood pressure medication is also a thing that needs to be understood correctly. Point 5. Blood pressure medication needs to be understood correctly. Some people see better blood pressure in a few weeks and then think that medication is no longer necessary. They begin to want to take it every other day, reduce the dose, or self-change the time of taking it. This way of thinking is quite common because everyone wants to use less medication. But with blood pressure, a few good readings are not enough to conclude that the body has stabilized long-term. Many times, better numbers are because medication, eating and drinking, exercising, and monitoring are together exerting their effects. If you self-change medication, blood pressure can fluctuate again in some people. This needs more caution if you have heart disease, kidney disease, diabetes, have had high blood pressure many times, or are using many other types of medications. Blood pressure medication is usually considered by doctors based on age, measured readings, underlying conditions, and general health risks. Therefore, when the reading is better, the thing that needs to be done is not to self-decide, but to continue monitoring and discussing correctly. Taking blood pressure medication is not a failure. It does not mean that you care for yourself poorly. For many older adults, medication is a part in the plan to control blood pressure, beside appropriate eating and drinking, regular walking, better sleeping, and measuring blood pressure at home. The important thing is that you understand why you use medication, how to use it correctly, and how to monitor the body. When understanding correctly, you will worry less and be more proactive in the task of taking care of your health. If you want to reduce the dose, change the time of taking, change the type of medication, or have uncomfortable symptoms after using medication, please discuss with a doctor or pharmacist first. When going for a checkup, please bring along the home blood pressure record table, the list of medications currently being used, and the time of taking medication every day. If there is dizziness, unusual tiredness, leg swelling, prolonged coughing, or urinating more, you should also record it. These pieces of information help the doctor evaluate more clearly and adjust the plan if appropriate. When medication is used correctly and monitored correctly, the remaining part is the small habits you can do regularly every day. Point 6. One small lifestyle but done regularly is what is important. You do not need to change your entire life in one day. With blood pressure, the more important thing is to choose small things that can be maintained. One suitable change, done regularly every day, usually has more value than many big changes, but only done for a few days. You can remember according to 3 simple steps. One is to choose one small thing, for example, walking a few extra minutes, reducing high sodium dishes, sleeping more on time, or measuring blood pressure more regularly. 2 is to choose a fixed time in the day to perform it, like after breakfast or before dinner. 3 is to have a way of monitoring, such as writing in a notebook, wall calendar, or phone. When that thing becomes a habit, only then do you choose another thing. This week, do not try to do too many things at the same time. Please choose one specific action and suitable for your health. If you are physically inactive, please start by walking lightly. If you often eat processed foods, please read the sodium label before buying. If you often forget to measure blood pressure, please place the measuring device in a place easy to see. If you sleep irregularly, please try keeping your bedtime more stable. The important thing is to do it regularly and record the results. In the next part, we will gather all the content into a set of easy-to-remember rules so you can self-apply daily. You will know how to measure correctly, record the reading, look at the repeating measurements, pay attention to sodium in food, understand correctly about medication, and choose one small change to begin. When these steps are put together, the task of caring for blood pressure will be clearer, less confusing, and easier to maintain. Before finishing, please remember a simple set of rules to monitor blood pressure better. 1. Do not only rely on feeling. Feeling healthy does not mean that blood pressure is always at an appropriate level. 2. Please measure correctly. Sit and rest for a few minutes. Place the arm at heart level. Do not talk while measuring. 3. Please record the results, including date, time, top number, bottom number, heart rate, and the circumstances at the time of measurement. 4. Please pay attention to numbers repeating over many days, not just one single isolated measurement. 5. If currently taking medication, please use according to instructions and discuss with a doctor before changing. Blood pressure is not a thing for you to be ashamed of or avoid. Blood pressure is information about your health. When you understand correctly, measure regularly, and record clearly, you are doing one very practical thing for your heart, brain, kidneys, and blood vessels. No need to change everything in one day. Just need to start with one small thing and do it more regularly. If this video helps you understand blood pressure more clearly, please share it with a relative over 60 years old, a person currently taking blood pressure medication, or a person who often says, "I still feel healthy, so it's probably fine." Maybe they also need to hear this. In the next video, we will talk about common mistakes when measuring blood pressure at home, because just measuring the wrong way, the number you see might not yet truly reflect the actual condition. This content only carries a reference nature and does not replace medical diagnosis or treatment. This video only carries the nature of providing information and sharing knowledge. The content does not replace diagnosis, treatment, or medical advice from a doctor. Viewers should consult the opinion of medical experts before applying any method mentioned.